Hello everyone, my name is Kelvin Musendeka. Actually, I just want to share with you on hypertension. Hypertension is the most known or most common cardiovascular disorder, and hypertension is defined as sustained high blood pressure having a systolic pressure of 140 and the systolic pressure of 90. Hypertension is classified into two types. There is what we call essential hypertension and non-essential hypertension or secondary hypertension. Essential hypertension is also known as a primary hypertension. A primary hypertension, it's idiopathic, meaning the causes are known, but it's mostly known to learn in families. Secondary hypertension, it is a type of hypertension which is secondary to the underlying diseases, or a type of hypertension which occur due to underlying diseases. And examples of these diseases I'll give is renal diseases, we have adrenal disorders, cardiovascular disorders. Even drugs can trigger hypertension. In other way we can classify hypertension, we have a malignant hypertension and a benign hypertension. Benign hypertension is a type of hypertension whereby a patient is having high blood pressure and without symptoms. You have the high blood pressure but you can't even feel the symptoms, and it has a long-term effect in the body. Then the other type of hypertension, which is malignant hypertension, is a type of hypertension where there is a patient can feel that no, something is wrong in the body, or it's a type of hypertension with symptoms. Hypertension, or let's talk about factors which causes hypertension. Examples of these factors are obesity, taking too much or too much food rich in sodium, fats, taking too much fats, or cholesterol. Example of the disease that I'll give which can occur due to too much cholesterol intake, which is atherosclerosis, which causes the blockage of an artery, resulting in the increase in the blood pressure. Other causes of hypertension, stress is one of the causes of hypertension, obesity. Other factors includes increased age. Increased age can cause hypertension. Even exercises can result in hypertension. These are some of the factors which causes hypertension. Let's talk about okay, hypertension is direct proportion to the product of cardiac output and peripheral vascular resistance. Hypertension is a product, is direct proportion to the product of cardiac output and peripheral vascular resistance. So the increase in peripheral vascular resistance and increase in the increase in peripheral vascular resistance and increase in cardiac output result to an increase in blood pressure or increase in hypertension or increase in blood pressure. Hypertension can result in 4 atomic sites, which includes, we have postcapillary venues, arterioles, the kidney, and the heart itself. Let's talk about how does the body regulates hypertension. The body consists of receptors, and examples of these receptors I'll give is the carotid baroreceptors, um, the carotid baroreceptors, and beta receptors. We have alpha receptors, even calcium channels. These are examples of receptors I'll give, which involves in the regulation of blood pressure. So receptors, sympathetic effect, and relax, these are the factors which helps in the regulation of blood pressure in the body. So let me start with carotid baroreceptors and sympathetic effect. The carotid baroreceptors, they are located in the blood vessels and can be stimulated due to the following reasons. One, stretch of the blood vessels, change in postures, which decrease in blood pressure, decrease in blood volume. These or constriction of the blood vessel, these are factors which can trigger the stimulation of carotid baroreceptors. So if there is a stretch in the blood vessel in a situation whereby the blood pressure is too high, the carotid baroreceptor will detect via the sympathetic effect and send more inhibitory impulses to the vasomotor center and result in the inhibition of sympathetic effect. These will cause the dilation of blood vessels. Therefore, there will be a restoration of blood pressure. In a situation whereby the blood pressure is too low, the carotid baroreceptor will send the fewer inhibitory impulses to the vasomotor center, which is medulla oblongata, and send and cause the increase in the sympathetic effect. And increase in sympathetic effect result in increase of norepinephrine circulation, and norepinephrine circulation results in the vasoconstriction, increase in peripheral vascular resistance, and the cardiac output. This is how the body regulates blood pressure itself via the carotid baroreceptors and the sympathetic effects. Let's talk how does the body control. Let's talk about other factors. I've mentioned the receptors, which is the carotid baroreceptors, the sympathetic effects. Let's talk about renin, angiotensin, aldosterone system. The blood vessels, the kidney or the kidney consists of arterioles. So if the blood pressure or blood volume in the arterioles decreases, the kidney will detect. The arterioles consist of receptors which will detect the change or the decrease in pressure of the blood or of the volume. It will detect and send an impulse to the vasomotor center, which is the medulla oblongata. Then it will cause the increase in renin secretion. So the increase in renin secretion, the liver produces, which is the renin angiotensin, the angiotensinogen. The liver produces angiotensinogen. Then when renin meets with angiotensinogen, it will cause the production of angiotensin 1. Then angiotensin converting enzyme converts angiotensin 1 into angiotensin 2. Then angiotensin 2 have the following effects. 1, increases the sympathetic effect and increases the aldosterone hormone secretion. So increase in sympathetic effect causes the increase of norepinephrine, and other effect angiotensin 2 has, it increases the breaking of bradykinin, which is a vasodilator. So this results in the inhibition of dilation of the blood vessel. And sympathetic norepinephrine causes the constriction of blood vessels, which will result to an increase in peripheral vascular resistance and cardiac output, resulting in the increase of blood pressure or restoration of the blood pressure. Increase in aldosterone hormone circulation results in the absorption of sodium and water back into the blood, into the circulation system. This results in an increase in blood volume. This would result in the restoration of blood pressure. My name is Kelvin Sendeka. I just wanted to share with you on hypertension. Thank you very much. May God bless you. This is part 1. May God bless you.